Today's nursing mindset is about oxygen therapy and delegation. When students first learn about oxygen therapy, it's easy to think, well, it's just oxygen. But here's the nursing mindset. Oxygen is a medication. So like any medication, it has indications, prescribed doses, potential risks, and requires ongoing assessment. That means every decision involving oxygen should begin with one question. What does my patient need, and is this intervention safe? Let's start with the nurse's responsibilities. Before oxygen is ever applied, the nurse must assess the patient. That includes evaluating respiratory rate and effort, lung sounds, oxygen saturation, work of breathing, skin color, and the patient's overall clinical condition. Assessment always comes before intervention. Based on that assessment, the nurse determines whether oxygen therapy is indicated, initiates the prescribed therapy, adjusts the prescribed flow rate when appropriate, and continually evaluates how the patient responds. So just as importantly, the nurse provides patient education. Patients need to understand not only how to use oxygen correctly, but also how to use it safely. So let's talk about delegation. A common misconception is that oxygen therapy can simply be delegated to anyone. And that's not exactly true. Depending on your facility's policies, a nursing assistant may apply a nasal cannula or oxygen mask only after the nurse has assessed the patient, initiated oxygen therapy, and established the prescribed flow rate. A nursing assistant may also provide skin care around the ears and the nares and reinforce previously taught instructions. However, the nursing assistant must immediately notify the nurse if the patient's respiratory status changes, if the patient develops chest pain, if they repeatedly remove the oxygen device, or if they have concerns related to skin integrity. Here's the key point I want you to remember. Turning oxygen on, initiating oxygen therapy, or changing the oxygen flow rate cannot be delegated. Those actions require nursing assessment, clinical judgment, and evaluation. In other words, they remain the responsibility of the nurse. Now let's shift our focus to oxygen safety at home. Many patients require oxygen after discharge, and safe use at home is just as important as safe use in the hospital. The first rule is simple: no smoking, ever. No one should smoke or vape near oxygen equipment. Patients should also place no smoking signs both inside and outside the home to remind visitors that oxygen greatly increases the risk of fire. Next, avoid petroleum-based products. Items such as petroleum jelly, so like Vaseline, vapor rubs, and petroleum-based lip balms like Carmex should never be used around the face or nose while receiving oxygen therapy. Instead, recommend water-based products to reduce dryness safely. Oxygen cylinders also require proper storage. Tanks should always be stored upright, secured in an approved stand or cart, and kept in a well-ventilated area to prevent them from falling or becoming damaged. Electrical safety is another important consideration. Patients should never use extension cords with an oxygen concentrator. They should also avoid using electric blankets, heating pads, hair dryers, or electric razors while oxygen is running, because these devices can increase that risk of fire. Finally, let's talk about cooking. Patients should never wear oxygen while cooking over a gas stove or open flame. If possible, maybe encourage the use of something like a microwave or slow cooker instead, and always recommend keeping a fire extinguisher readily available in the home. Notice that every recommendation we've discussed has the same purpose: protecting the patient from preventable harm. That's what nursing mindset is all about. It isn't simply knowing how to apply a nasal cannula, it's recognizing which tasks require nursing judgment, knowing what can and cannot be delegated, anticipating potential hazards, and teaching patients how to stay safe long after they leave the hospital. So the next time you see a patient receiving oxygen, don't just ask, how many liters are they receiving? Ask yourself, am I providing this therapy safely? And is my patient responding appropriately? That question reflects the way professional nurses think. Remember, oxygen is a medication, and every medication requires assessment, clinical judgment, safe administration, and evaluation. Every safe nursing decision begins with the right mindset. So keep developing your nursing mindset.